Today I will present
Recording
a
in
family case
progress.
presentation. Uh, Honestly po, actually, hindi po talaga yung original case presentation ko. My first patient, namatay po yung first patient. Yung second patient ko naman po, di nakapag-follow up check-up. Kaya medyo na-rush po ito. My third patient po. What are the objectives? To identify medical, psychological, social, and economic problems of the index patient and his family. To present criteria for admission to the family healthcare program. To analyze the family dynamics using the family assessment course. To discuss plan for the follow-up care that will emphasize the role of the family and the physician in the management of the patient illness. To present a comprehensive healthcare plan for the patient and his family. For our index patient profile, NG, a 48-year-old male, married, unemployed, living in Baliki, San Fernando. For our chief complaint, neck pain. For our HPI, 16 years prior to consult, patient had his regular checkup, diagnosed of having stage 1 hypertension, but no accompanying symptoms. And patient was given metoprolol 50 milligram tablet once a day, but unfortunately, patient is not that compliant. 14 years prior to consult, patient accompanied his friend to emergency room, and the patient had also checked his BP. His BP is 170 over 100, but still asymptomatic, given furosemide IV and was advised for follow-up checkup. The next day, patient was given 10 unrecalled medications for heart disease uh, and hypertension, but patient is not totally compliant. Nangyari po ito sa Saudi Arabia, and hindi masyadong na-explain ng doktor na maayos kung para saan daw po yung mga medications. Sabi ni patient, sinabi daw po sa kanya is for heart attack, but patient hindi masyadong naniniwala since wala daw po siya nararamdaman. After 1 year, 13 years prior to consult, patient had decreased in appetite and claims this due to over fatigue. Tumagal po yung shift ng trabaho ni patient, naging 20 hours per day na siya, 6 times a week. And his medication, sinabi ni patient, is nag-increase daw po yung creatinine niya, normal, but nasa borderline po. Thus, he stops taking his maintenance meds and decided to shift to drinking apple cider and eating garlic. 4 years prior to consult, still with knee pain, patient consulted and his BP is 150 over 100. May mga ginawa pong labs with high cholesterol, triglycerides, but patient refused taking prescribed meds and opted still for apple cider and garlic, and dinagdag po ni pineapple. 6 months prior to consult, increasing frequency of neck pain, but still no consultation done since it's tolerable daw po according to patient. 1 month prior to consult, patient was advised by his son to consult for the prescription of his maintenance to be priority on COVID vaccine. Pinapacheck up lang po ni tatay niya para daw po magkaroon ng reseta at maging priority sa vaccine. 1 day prior to consult, due to persistence of neck pain and the need for prescription for maintenance, patient sought consultant on. For the past history, patient has resistant rhinitis, right? 2014, history of dyslipidemia, 2017, no diabetes, no asthma, no TB. Immunization according to patient is complete. For the family history, father is hypertensive and with kidney disease. PTB rin po si father, and older and younger sister po. No asthma, no diabetes, no family history of allergy and cancer. For the personal social history, patient is non-smoker. Patient drinks alcohol, beer, 2 bottles per day, once a week for 9 years. But patient quoted nung nag-shift po siya sa pagiging Muslim. Patient denies illicit drug use. Diet, mixed diet, vegetables, fruits, meat except pork nung naging Muslim po siya. Patient is store owner, college graduate, IT, but after that, patient took short courses on sterilization of medical equipment. Thus, household chores goes to church every Friday. For the review of systems, patient has no sweats with insomnia sometimes, no anxiety with interpersonal relationship difficulties, no result to weight change, no weakness, fatigue, chills, night sweats, no color changes, no rash, photosensitivity, changes in hair, nail, skin, itchiness, no blurring of vision, tinnitus, discharge, epistaxis, bleeding, and sore throat, No hemoptysis, chest pain, no cough, no nausea, vomiting, hematemesis, melena, hematochezia. No dysphagia, epic pain, heartburn, no heat intolerance and cold intolerance, polyphagia, polydipsia, polyuria. No muscle pain, no joint pain, no varicosities, claudication, dysuria, plankton, frequency, urgency, no headache, seizures, and irreversibility. For our physical examination, vital signs of the patient during the consultation, BP of 160 over 100, pulse rate of 81, RR of 31, temperature of 37, oxygen of 97% via room air. Weight is 70 kilograms with a height of 5'3", BMI of 26.43. For the general survey, patient is conscious, coherent, oriented to 3 spheres, ambulatory, not in distress, warm, moist, no active dermatosis, scar on the wrist right due to the tendonitis, nagkaroon ng operation si patient. Anapteric sclerating palpebral conjunctiva, no cataract, no exudate, hemorrhage, no cotton wool spots, no mesoaureal discharge, moist buccal mucosa, non-hyperemic posterior pharyngeal wall tonsils not enlarged. On the neck, no palpable cervical lymph nodes, subtle neck, thyroid not enlarged, no other palpable masses, JVP not elevated, non-distended neck vein, no carotid brow. For the chest, symmetrical chest expansion, no retractions, clear breath sounds. For the heart, normal rate, regular rating, dynamic recording. Apex beat in fifth, left intercostal mid-clavicular line, no murmur. Abdomen is flat, normal active bowel sounds, soft, non-tender, no masses. Extremities is no cyanosis, no edema, pulses full and equal. There's no limitation bilateral shoulder abduction and extension, no focal neurological deficit. For our assessment is hypertension stage 2 uncontrolled to consider dyslipidemia. Short description lang po. Hypertension is defined as a systolic blood pressure of SBP of 140 or more, or a diastolic blood pressure of 90 or more, or taking antihypertensive medication. For the normal, systolic lower than 120, diastolic lower than 80. Pre-hypertension defines our systolic 120 to 139, diastolic of 80 to 89. Stage 1 is systolic of 140 to 159, diastolic of 90 to 99. Stage 2 is systolic of 160 or greater, diastolic of 100 or greater. Hypertension may be primary, which will develop as a result of environmental or genetic causes, or secondary, which has multiple etiologies, including renal, vascular, and endocrine. For our criteria for admission to the family healthcare program, cooperative patients and their respective families, accessible homes, both by physical location and security reasons, potentially dysfunctional families, families with chronically ill patients. For the environmental story, concrete type, 2 rooms, 1 comfort room, and 1 sari-sari store, fairly clean, well ventilated and well lit. Water source from water purifying station. Toilet type is flush, drainage is good. Regular waste disposal, no segregation, but regularly collected. Do not have pets, but there are many stray animals and pests in the neighborhood. The area is accessible by both taxi and tricycle. For our family assessment tools, every patient is a member of a family. A physician must always keep in mind that the way of the patient reacts to an illness will depend a lot on his family. It will depend on the family physician as to up to what level he will involve a patient's family to evaluate his problem. Relationship between families and their physician is a powerful vehicle for influencing patients about issues regarding health and illness. Thus, a good family assessment is needed in order to promote a working alliance. Designed for family physicians to have a systematic way of understanding the family and to aid them in evaluating the impact of illness on a person and to his role in the family. Family structure. A genogram can be used to generate data about individual couple or families, especially inheritance patterns, family illness, family members, family structures, and emotional process over time. So for our genogram, our patient is from Galang family, while his wife is Suba family. Our patient have hypertension, tendinitis. Nagsabi rin po siya ng cholelithiasis upon history, but wala pong mapakitang diagnostic sa akin si patient, and upon physical assessment, wala rin po akong proof na meron siyang cholelithiasis. Patient also has dyslipidemia. Patient has 2 wives, MG, 52-year-old, and AC, 48-year-old. For his first wife po, Meron siyang isang anak, si RJ, 26 years old. And meron po silang nagkaroon ng spontaneous abortion noong 2004. To AC, wala po silang anak. Patient, si father po niya is may history ng hypertension, TB, and kidney disease. Both of his sisters meron pong history na tuberculosis. May question po? Hello? No questions po?
Hi, Doc.
Yes po.
Sino si AC? Ano niya yun?
Actually, Doc, hindi ko lang mapantay dun sa part ng patient kasi di na nagkasya. Second wife po niya, Doc. Muslim kasi si patient, Doc.
Okay, thank you.
Ryan, sorry.
Yes, Doc.
Hindi ko masyadong mic.
Sorry, Doc.
Yung ba't parang
Hindi ko lang napantay si second wife niya doon sa part, yung sa second.
yung wife?
Hindi ko lang mapantay. Yes po, si first wife po niya si MG, Doc.
Okay. Pwede mo kasi ibaba gawa, tapos itabi mo yung second.
Actually, Doc, ayusin ko sana kaso biglang di ko na estimate yung sukat ni second wife. Hindi ko nasama sa sukat.
May M. Ano yung M? MCP? Dun sa isa.
Si MC50, Doc, siya po yung first husband po nung second wife niya.
First husband.
Yes po, married po sila nung 1997, separated po nung 2007.
Lalagay mo na line yan.
Ay proper way kasi oo, para hindi masyadong genogram like may katabi. Pwedeng yung asawa mo dun sa isang sabab. Hindi ko alam. Kasi ibaba yung mag-asawa. So, iba may pag naghiwalay sila. Naghiwalay ba sila? Tama ba?
Yes, Doc. In-slash ko na lang yung sa gitna, Doc. Nilagay ko, married noong 1997, separate po ng 2007, Doc.
Hello, sorry pero parang back talaga. Ano? Ayun, so kung wala sila, may diagonal 1997 hiwalay.
1997 po, married po. 2007, separated sa first husband po niya, Doc.
Kasi dapat hiwalay sila. Para alam natin. Naghiwalay sila. Tatabi mo yung ngayon. Hindi naman ito sa kanila. Oo, easy. Tapos minsan yung asawa ng second wife, nilalagay sa kabila. No, pag ganyan, para mas malinaw siya. And then,
Opo.
itong mga yun, kasi hindi rin pwede yung di ba? Pwede man hindi sila kasal or nag-iwalay sila. Parang lumulutang si MC.
Noted, Doc.
Kasal, dotted line, kung kasal sila,
Kasal po sila, Doc. Naghiwalay.
At least, nakalutang mga lakbat. Kasi parang dalawa yung
Anak po ni MC tsaka ni AC, yung tatlo po.
So, yun nga. Line kasi isang line na lang. Tapos, di ba?
Yes po, Doc.
Parang nakalipit. Sorry.
Hello po.
Ay, hello, Doc.
Mail po namin na ihan yung communication. Kasi parang nag-e-echo.
Actually, sa lahat.
Nag-e-echo.
Hindi ko alam kung paano.
Sa akin po ba?
Nag-e-echo siya.
Parang bawat nagsasalita na echo.
Wala. Nandito po ako sa ONA, Doc, pero ako lang po yung mag-isa dito sa pantry.
Wala kang wifi ako eh.
So, Wi-Fi po ako nakakonect. Pero wala na, nasa ER po yung mga co-residents.
Anyway, parang bumubuti na ba siya? I mean, nag-e-echo rin na kay sa akin. Yung sa iba, medyo
Nag-e-echo din siya sa amin doble po. Kaya hindi namin naintindihan yung exchange.
Yung sa akin din po ba?
Pwede ba tayong magbago ng link?
Ay, sige po, Doc. Sabihin ko po kay Doc Jobel.
So, mag-out tayo, tapos pasok na lang agad sa link.
Noted po, Doc.
Kasi sayang po yung same information.